Welcome. We are the healthcare providers to educate you about croup and how this may help your child. A croup is a virus infection that causes swelling of the upper airway, the windpipe, the voice box, and the vocal cords. And a croup causes a barking cough sound of a seal's bark, a raspy voice, high pitch, and squeaky noise when they breathe. And they may be without a fever or have a low-grade fever. And this illness is seen more often in the winter times. And is it contagious? Yes, croup is very contagious. It is spread by airborne droplets, a bacteria that spreads when a person coughs, and it's spread in the air or on a surface, and a child or adult catch it. And the preventative measures to minimize the spread of croup. First is you have to cover your mouth when coughing or sneezing. You have to avoid touching objects contaminated by a child who has croup. You gotta wash your hands and sanitize items such as toys, utensils, cups, and other objects that's been contaminated by mucus from an infected child. And lastly, you have to keep the infected child at home and avoid playmates until he or she is free from the infectious virus.
Now for assessment. When you're looking at assessment compared to a doctor and a nurse, it will be the same. The only difference is that a doctor is able to order special procedures such as an x-ray to be done. Now, both a doctor and a nurse health practitioner would be able to take a blood pressure, which would be the same between a toddler and a preschool, and it may vary patient to patient. However, it should be around the same range. Looking at the part of vital signs is looking at the beats per minute, and you're going to compare it to both the toddler, the respective age of the child that has croup, and it will vary from 110 beats to 60 to 100 beats, and you'll compare it respectively to the age. Now with the temperature, you're going to be looking at if they have a fever. Now not every child that has croup will have a fever, and so depending on how you take the temperature will be varied, and that's how you look at it and approach it. Now, the most important thing is checking SpO2 levels. It's the oxygen levels in the blood. And with croup, when it's very serious, the oxygen levels are very, very low. And so that's why it's so important to check it. Now, beats per minute, you're going to vary depending on the toddler, and you're going to be counting it either if you're a doctor or a nurse. Beats per minute, breaths per minute, sorry. And as you continue, you're going to be comparing the breath sounds. And with a child that has croup, it's very hard to breathe because they're so congested and it's working their systems and their lungs very hard. So somebody with croup might have very hard, many breaths per minute. Now, when you're looking at the lung sounds, you're going to be looking at it from the both and the back. And what you're really listening for to assess it for it to be croup is for stridor. And stridor would be a high-pitched squeaking sound. And the telltale tale is barking cough, and that's what you're going to be looking for, and you're going to listen to it, and you'll be able to listen to it during auscultation. Also with cough is you're going to be looking at if the patient has cough, are they coughing at night, and if they're coughing, is there any color in their cough? Are they producing anything that presents color? Same with nose. Are they having a stuffy nose? Do they have a runny nose? And what color is coming out of their nose? Because that's really important to document. And again, with any type of infections, you're assessing the lymph nodes, inspecting the throat, and assessing the skin and lips, because in serious cases, a child may appear to have bluish lips or have lack of oxygen. Because of that, they have lack of oxygen. And so you're going to be looking at that to see if it's present. And with a child, you're going to always ask a parent, do they have any recent illnesses that cause fever, runny nose, or congestion? Do they have a history of croup or upper area problems? That's really important for your assessment. And again, the doctor is looking for the telltale signs of croup: barking cough, stridor, raspy voice, temperature, and any cold and cough symptoms of stuffy nose or runny nose.
Intervention the patient can do in the proper hand hygiene. They can wash their hand at least 20 seconds, and also we can encourage the patient to do some exercise such as just walking around the house. Also we can offer the toy to the patient and make the patient relax from the pain or anxiety. Also we can open the patient favorite movie or cartoon. And also we can offer a fan to move the air in the environment such as humidifier. Also, we can incorrect the fluid intake, for example, the water or orange juice. And also we can keep the child comfortable in comfortable position, such as we offer the pillow put at the back of the child. And this is the picture of the intervention that we need to wash hand properly. And another picture is the kid that drink more water.
For evaluations, how will a parent or guardian know that the child is getting better? Child's airways would become clearer and it would be easier to breathe. Child's fever and barking cough would also subside. Approximately how long does the disease last? Most children usually feel better after 3 to 7 days. Symptoms are usually worse at night, and during the day your child may seem fine, but symptoms progressively gets worse throughout the day.
Is it curable? Adrenaline, it's something that counteracts the allergic reaction towards various foods, drugs, and venoms. It's known to get you ready to run away or fight. It relaxes smooth muscle and dilates the airways of the lungs, essentially canceling out the effect of the inflamed bronchi, allowing the infected to be able to breathe. An aspect of this is how it essentially works to cancel out the anaphylactic or allergic reactions of asthma. So corticosteroids, which specifically dexamethasone in this case, is more so centered on alleviating the swelling as a whole rather than the central aspect of opening up the airways, such as what adrenaline does. Small doses of around 0.15 to 0.30 milligrams per kilogram of weight that is associated with less hospital returns, less observed swelling, and a lower need to even use epinephrine. So cool mist buildup within a tight closed room was used historically for the treatment of croup within hospitals. What this did was it caused the general alleviation of the symptoms talked about above. Since croup is caused by so many different viruses, such as influenza and parainfluenza, healing it once does not make you immune to the other viruses involved with these symptoms, and that of which your body has no experience dealing with. So yes, you can catch it again. So, this has been our presentation on croup. Thank you for listening.